Joining me now to provide another perspective on the Health and Human Services budget passed during the 2017 session is the ranking minority member of the Human Services Reform Committee, Senator Jeff Hayden. Welcome.
Thank you. Thank you for having me.
So what did the legislature get right with this Health and Human Services bill?
Well, I don't think from a fiscal responsibility standpoint they got much right. And I just wanted to lead with that we spent down the provider tax, but we didn't provide relief to the sunset of that in order to make sure that we have the dollars to sustain it.
You're talking about the funding for the Healthcare Access Fund, which comes from a provider tax, which sunsets, I believe, in 2020?
Absolutely. So we spent the money, but we didn't relieve the sunset. So in other words, that dollars aren't coming in. So in 2020, we have $1 billion hole if we don't do anything else. So before we get to what we spent it on, and there were some things that we did that I think were important, child care assistance, the security hospital at St. Peter's, some elderly waivers. So I don't want to say that we didn't do good work in terms of who we funded, but the funding mechanisms and how we funded them, I don't think that we did very well, and I think it was very fiscally irresponsible.
And some critics have said that really there was just some shifting of money around as opposed to bringing in new money, but services are expected, the need for services is expected to increase in coming years. Mm-hmm. So as a state, how are we going to tackle that problem?
Well, that's what we have to do. It's a tough problem, and shifting dollars, payment shifts aren't going to work. We really need to pay our bills on time. That was something that we did. Once again, the Healthcare Access Fund, which is provided for the provider tax, we didn't do any work to see if we could reform that. I know that there's some concerns about how we use that money, but we used that money. We didn't do a very good job on the reinsurance program. I think it could have been done much better. We should have means tested it. We should have really spent a lot more time in thinking about it. It was just pushed through without, even at a certain point, it didn't have a fiscal note, maybe until it hit the floor.
Though there was some urgency in that area. I mean, if you had studied it longer, then maybe the funds would not have been available as quickly?
Well, we did some analysis, and we did about 50 hours less in Health and Human Service this biennium than the biennium before. So we had the time, we just didn't take it. We had the time during the legislative session to extend our meetings to be able to have this conversation, and the chairs chose not to do it. I guess they wanted to get home as opposed to sit here and do the work that we were supposed to do. So we did have the time to do it, we just chose not to use it wisely.
Governor Dayton, when he signed the bill, said it fails to sufficiently fund the urgent and ongoing needs of our state. It sounds like you agree with him. If the DFL were in charge, how would things have been done differently?
Well, one of the things that I think is the Minnesota Care buy-in option was something that we really thought was a better way to go. That allowed people to go on a Minnesota Care-like program if they're in a region of the state that didn't offer sufficient choices for them. So it gave people the access that they wanted. It allowed them to see the provider, hopefully, that they were looking for, because Minnesota Care has relationships with a much larger provider network. And it was cost neutral. It didn't cost a lot other than the setup. So if the DFL was in charge, that's what we would have done.
You would have started that Minnesota buy-in option
Absolutely.
Right away.
Absolutely.
I sort of already asked this question. I'm going to ask it again, though. Budget dollars are limited, and people needing services, it will climb. So, and you talked about the Healthcare Access Fund and those shifts. In your view, is the state facing a fiscal cliff in terms of how Health and Human Services is funded? Okay.
We definitely are, and we're really nervous because we don't know what's happening in Washington. And what has been proposed with the block grants on Medicaid is really scary in terms of shifting those dollars and then not allowing those funds to grow as people need the services more. So if we're facing a block grant from the feds and we are not going to provide the relief on the provider tax, we're not even having that conversation, then we're already going into a structural deficit, and we don't have enough money to take care of grandma, our disabled community, or our children, because that's where the bulk of the money goes.
And so right now you're talking about those Republican-led efforts to curb the growth of Medicaid. What options will Minnesota have to address the lack of funding from the feds?
Well, I think everybody will say we need to get behind the cost. You know, we have just kind of gone along and said, this is how much things cost, and then we have to pay for it. So I think everybody, Democrats and Republicans, really need to sit down and figure out what the cost curve is. We need to look at the pharmaceutical companies. We need to look at what providers are charging. And I'm not suggesting that they're charging us too much, but it appears that those are things that we can do. We need to deal with wellness programs and helping and involving people to get involved with their healthcare decisions. But we really need to get, and there are there's great data and great best practices that I hope that we can spend some time in dealing with this issue of cost. At this point, we're simply accepting whatever the costs are, and then we're trying to find the money to cover that.
Critics argue that the Affordable Care Act caused federal overreach into healthcare policy. In a Star Tribune op-ed this week, Senator Jim Abler, who is chairman of the Human Services Reform Committee, said, quote, "Federal reforms have made matters worse in Minnesota. The best reform would return regulation of health care and insurance to states. Let Minnesota take care of itself." What are your thoughts on this idea of putting the policymaking back to the states as opposed to the federal?
Well, let me just say this. There is a romanticizing of what happened in the past. When we talk about MSHA or high-risk pools, they cost a lot of money for the patient. That was a person that had pre-existing conditions. That was a tax on insurance companies, right? Providers didn't get the rates that they were looking for. So people talk about that, including Senator Abler, as if that was the great old days. People were looking for an opportunity that was much different than that. I do think that we have great policy folks in Minnesota. However, the ACA did provide us with some guidance, for instance, like essential benefits set. It says if you're going to provide insurance, it should have an essential benefit that people can use as opposed to one that doesn't do anything for anybody. The federal government imposed that on us, and I think that that was the right thing. The other thing on Medicaid is that we give the federal government a lot more than we get back. So we should be able to get back the money that we send the federal government to take care of our folks. So I think that there are waivers and other opportunities that we have been successful in Minnesota at doing. Remember, the issue and the crisis has really been around about 2.5% of the people on the individual market that weren't getting a subsidy, right, for their plans. Those are important people, as everybody is, but that is kind of where we focused as opposed to looking at the system as a whole. And the opportunity for us to move forward and to refine the things that we do in Minnesota. There's an opportunity, if the ACA stays in place, which it looks like it is today, there's an opportunity to do a waiver, right, in a couple of years to kind of refine that and make it state specific. Let's work on those issues as opposed to throwing away the baby with the bathwater. We saw what happened in Washington with that. They don't have anything to replace it. So I think that this utopian idea that Minnesota does it well is great, but there are a lot of things that we paid a lot for that we're not paying for, that those costs aren't being attributed directly to the consumer's pocketbook because the federal government is helping us.
Senator Hayden, I want to thank you so much for your time on this very complex issue.
Thank you. I appreciate it. Thank you so much.